Welcome back to Your Health Matters. My guest today is Dr. Donovan Schmidt, and he is here to share his personal story of having open heart surgery right here at KRMC. Thanks for being on the show today.
Thanks again.
Now, we were talking earlier in the program about, you just kind of touched lightly on the fact that basically your heart stopped twice after you had that surgery, right?
Right.
So you were up on CVICU at the time when that
That's correct,
happened? Which is cardiovascular intensive care unit, for those that don't know what that means.
Right.
So what happened?
Well, I don't know what happened the first time. My son was in the room with me, and so my wife was at home getting something, and so she was with me the second time, and I'm told that I was just holding her hand and we were watching television, and all of a sudden I squeezed her hand a little bit and my eyes rolled back. And they ran in again, and they were there so fast that she thinks that I probably didn't miss 20 or 30 heartbeats before they were resuscitating me and brought me back.
Great. Now I know because when you're in, and obviously that critical care unit, that you're on a telemetry monitoring system, so they're watching
all sorts
everything.
of equipment.
Right, you're hooked up from top to bottom, and they're watching you.
And there's even a couple little wires that came right out on my skin, and these little wires are electrodes that are attached to the heart. So if the heart needs pacing, just hanging right up there is this little machine, a little pacer. Just hook it up and it paces your heart. I didn't need that, but it's so all the high-tech stuff is there.
Right, and you know, I guess I share with people all the time that in the past, obviously before Dr. Montero and his team started our open heart program, you would have just automatically been shipped.
Correct.
You would have not stayed in Kingman.
Yeah, there wouldn't have been a choice.
And you still have a choice whether you stay in Kingman or go somewhere else, obviously. I mean, you had 3 days to think about it. We talked about that. And you chose to stay here.
Right. You know, you're going to get a few naysayers here and there, but there was never a remote consideration to do anything but stay here and have it done. Right. You had
that much confidence in Dr. Montero and the team.
Right. Like I say, I've been around here 13 years.
Right.
We pretty well know who we can trust and who we can't. And,
well, and you've seen it grow and add.
And I've been a supporter of KRMC ever since I've been here, and and I felt just truly comfortable staying right here. And not only that, I had the good care, but you know, the family convenience.
Right.
And I was in a bit longer than average.
Okay.
And so just think of
because of some of the side effects we talked about earlier you had.
Complications. And so, would I do it again? Reluctantly, but yes.
Yeah, that's certainly not something I think any of us would raise our hand to volunteer for, but but if you have to have it done, it's good to know that you have that here.
Yeah, you know, and I'd be happy to talk to anybody about it.
Okay, that's good to know. Yeah.
So
well, and I think it says a lot when a doctor who knows what his options are and is familiar with healthcare, obviously, and not just here in Kingman, but in surrounding areas, and that you made the conscious decision to stay here.
Right.
You know, a lot of times people just assume, oh, Kingman, you know, it's just Kingman. And they just assume that they have to go to Phoenix or to Las Vegas to get quality health care.
No, and they certainly don't. You know, I was here when we had the old ER, and when Kingman's changed a lot.
Yes, it has.
Since 1998, and when I moved up here, someone says, "Why Kingman?" And all I could say then was, "Well, it's got a lot of potential."
Yep, exactly.
And it certainly lived up to it.
Yeah, very good. So, well, and it's cooler than where you're coming from.
Yeah, can't beat the weather in Kingman.
No, it's true. Well, and you know, like we were talking about earlier, I think that people just make the assumption because it's a small rural community and they've not really checked out Kingman Regional Medical Center and what we have. I mean, from diagnostics at our imaging center, you know, and to the cath lab, the cancer center, our state-of-the-art technology is pretty amazing.
And I've experienced most of that.
Sounds like it.
I had 40 radiation treatments last year for prostate cancer, so I've been through all of that technology and treatment. And yeah, I've always felt that, you know, in this, I can't say this is an accurate statement, but I've always felt that 90% of the medicine practice in the world can be done right here. And, you know, the other 10%, which is stuff we hardly ever see or hear of, you know, for the big centers. But that's my feeling. I've always felt that way.
Good. Well, and now with our new relationship that we have with Mayo Clinic, even more so, because now we're going to have, our doctors will have the ability to consult with Mayo physicians, right, and have the patients stay here and not have to ship them out for a lot of those others, like for the neurological, that we don't have a neurologist on staff right now, and those kind of gaps that we do have, Mayo's going to be able to fill in for us.
That would help a lot.
Yeah, absolutely. And like you said, being able to stay here with your family and your friends around you, and the expense of them having to travel and stay in hotels and all of that just makes a huge difference.
And then when you have, you know, just from a personal standpoint, when you have family and friends, you know, that's part of the healing.
Absolutely. So, I firmly believe in that.
My wife, bless her, spent a lot of time with me, and I know that that, I mean, I had great nursing care, it was just hands down. It was wonderful. But to have that little bit of extra family support, whether your wife was a nurse or not, just makes all the difference in the world.
And so Dr. Montero, he hasn't been on the program yet. His schedule we keep him pretty busy right now, which is you know, mixed thing for him. Good. But I know he has put together a great team in the cardiovascular center that is enabling him to provide those type of surgeries that we've talked about would be shipped out otherwise. So
yeah, without a doubt.
So now you and Luann are back. Are you back riding the bike, and you got a Vespa, right? Isn't that what you said?
When we sold to the hospital, we splurged and bought a couple of Vespa motor scooters.
So you each have your own. Very good.
So that's our little.
Well, that says a lot about your health too. Like we said, it's only been like 2 months, and you're already back. And
yeah, but I did what I was told.
Good.
And I stayed off of the motorcycles until 8 weeks, and because that's what they said. Usually I've have my own idea about the way I'm going to do things, but I followed the rules.
Good boy. I know that's
the orders.
Sometimes doctors can be the worst patients, right?
They can be. I was probably a little more demanding, but I tried to be a good patient.
Very good. So it's good. Now you were talking also earlier about the cardiac rehab program, and that you're about a third of the way through, maybe.
Almost a third. You know, I think I'll do number 9 today, and there's 36 sessions. And so there's an hour in the morning. You have a choice of an hour in the morning or hour in the afternoon. And then they also have some little talks about diet and the benefit of exercise. And I can't remember some of the other subjects, but you know, so they'll have these talks maybe once a week or once a month. And they'll have it just after the 1 hour of rehab.
So it's an education kind of
little education to go along with it. Yep.
Now that we've got your heart fixed, let's keep it healthy, right?
Exactly.
Yeah. That's good. And there's a lot of things that can lead up to that. Now you'd shared, of course, that your heart was in pretty good shape, luckily, up until you didn't actually experience a heart attack. So your body was still pretty strong.
Yeah, it was strong, but. It could have been one of those explosions any minute. Right. Because I didn't have chest pain or angina or anything.
No symptoms.
And so probably if this hadn't happened like it did, I'd have had that big fatal heart attack.
Wow. And it probably would have just been.
Yeah, it just dropped over.
Wow. Well, I'm glad you're still here.
Yeah,
and
me
Louis too.
Yeah, absolutely.
That's great, and that you're following instructions and being good.
Yep, yeah, I am.
So what are your plans for the future? What are you gonna be doing?
I'm just doing a little part-time work right now, and I'm always available, you know, if they need me, you know, to do a shift or two at Fast Tracks, and but they seem to be pretty okay right now.
And you said you're part-time at the jail. What are you doing there?
Well, I am at the Mojave County Jail. I work for a company called Corizon, and they provide medical care to the prisoners.
Oh, okay.
And so it's a brand new jail, a brand new clinic, and so I spend about 8 or 10 hours a week between there and the juvenile system.
Okay.
And so it's interesting, and you know, people always sort of say, "Oh my goodness, you know, what's it like?" And to be honest with you, most of them are just like anybody else you'll see in an emergency room.
Yeah.
They have a complaint or a problem, you treat it, and that's the way it goes.
Yeah. They just have a different bed they go back to.
Right, exactly, yep. Yeah, and they are.
Well, it's great that you're doing that, though.
Yeah,
and staying involved in the community.
It's fun. It's actually pretty fun. It's good work, and I'm blessed to have it, so I can slow down a little bit.
Yeah, that's very good. Well, I'm so glad you're on the show today and shared with our audience this information. I think maybe, hopefully, they'll feel better if they or a family member have to have that type of surgery in the future. Right. They know that they can stay here in Kingman, and it's been recommended by one of the best.
Well,
so
if they have questions, they can always, you know, get a hold of you in the in the department, and you know, get a hold of me. I'll be happy to talk to them.
Okay. Well, thank you very much for being on the show. I'm glad you joined us today. Stay tuned for next week's program. We've got another great guest.